So thank you so much all for being here. There's a lot of places to be on a Saturday, so we appreciate having time to be here in this room to bring back so many people here back to Damilola to talk about the important role of nurses and also the important role of your education here, both studying here and teaching here at Dalhousie University. And I'm so privileged to be here to doubt that and to speak with you very brilliant people. Annette and Danny, thank you too so much for your time and for your work in this field, and also for sharing your experience with us this afternoon. Thank you. Okay, so we're going to start this interview with the nurse. Can you tell us about a pivotal point in your nursing career that really stands out in how your time here at Dalhousie impacted you in that moment, for that pivotal moment in your career? Thanks, Amanda, for the question. I'll look into this to those in communication, sure, too. Very and also remarkable, so and maybe even answer the question a little differently. Absolutely, that's okay. So I'll tell you a little story. So I'm from rural Nova Scotia. Imagine fuzzy red-haired, so girl living in, some interesting times in rural Nova Scotia. And I remember the public health nurse coming. I could see her car coming up the road, and I would run and hide under the bed because I would see something to do. But I also knew she was coming with good stuff. She was still coming to help us, at a time when people in the neighborhood were living in poverty and needed the expertise and the insights of the nurse. That was my first connect with nurses. And then when I got a little bit older, my first real paycheck job, that is like a paycheck with my name on it, was at $13 in Nova Scotia, and I was at a consultant. And caring for others, caring with others, changed my life. Nursing changed the entire trajectory of my life. So, university wasn't necessarily something that a kiddo from rural Nova Scotia was thinking about at that time, but I went to university, and nursing taught me a couple of things. Being a nurse taught me several things. The beauty of human life, the complexity of human stories, that we need to come to those with kindness and with understanding. It's a purpose thinking. So what do we know about that? What do we know about that problem? What's the data telling us? What are other people doing about it? What are the people living that? How are they doing? How do we put that all together so that we make sense of the world? So who's probably I've had the good fortune of having several roles in nursing. So with others, and being there, my first job was at Debison, so being there at the first breath of life, and eventually working with other populations, being there at the last breath of life, and all the pieces of the team. I had the good fortune of also being an instructor in the School of Health Sciences, at the School of Nursing, and my very first classroom gig, I was terrified. Because actually, like the instructor, as a professor, I needed to know everything. You all feel that? All those new teachers, our educators, and the professors, you know that? And so I read everything, I did everything, and I was speaking bullets, and I'm listening, and there's all these beautiful faces looking at me, and there were about 100 students in the class. And guess what happened? Somebody asked me something, I didn't know. Oh my goodness, so what do you do in that instance? Well, you know what? That taught me humility. Because in that moment, I knew that my answer needed to be, actually, I'm not sure. I don't know. What does everyone else think? Can we talk about that? And hold the conversation in a whole new way. So nursing has been a whole level of beauty. When I say I'm a registered nurse, I feel it to my core, and I feel that proud to my core. well said, Dami. Seems like for you, a pivotal moment, I imagine it must be somewhere where there's what to study in the textbook, and then there's the real life situations that sometimes there is no right answer, and you have to figure it together. What's a pivotal moment for you?
Yeah.
I usually don't have scripts when I talk, but today I do have because I tend to talk quite a long time when I'm sharing my story. I think I get 20 minutes. This story will be like, oh, maybe we're going to ask about my story. So that was why I decided to just put it down because I know I couldn't say it in like 5 hours. So I've had pivotal moments in my life, like as a nurse. So not just one. That was why I decided to just write it down. And just thinking back to 10 years ago, and Ruth said something about, how we have come and where we are right now. I would say that 2014, coming to Dow, like my thing was filled with pain and joy at the same time. And I'll give you that context. So when um, Jack to do this, I'm really happy to see her. I picked it out the age of 12. And before I came, I decided to apply for my nursing license with the College of Nurses of Ontario. And at that time, that was 2011, even before I moved to Canada. At that time, I thought I'd already done 3 years of nursing diploma. I've done 4 years of baccalaureate degree, so I have 7 years of nursing education in Nigeria. And I also have years of experience, so why wouldn't I be registered in Canada? That was my thought process. But by the time I got there, I realized that so many internationally educated nurses experience a lot of difficulties in getting into the program. So 2011 gone, 2012 gone. And towards the end of 2013, that was when I kind of heard from CNO, that's the College of Nurses of Ontario, what I needed to do. And at that time, they just introduced us to me. So that's an exam, like a clinical exam. It had it in class or the written component as well. So I did that, and I was waiting for my results towards the end of December, towards the end of 2023. And come January, they sent to me a letter that I had one competency gap. And I knew for many people, like so many people had like 11, 12 competency gaps. The moment I saw that, I just thought my nursing career was over, right? So I didn't really look at the paper. And then a week, 2 weeks after that, I started kind of just reflecting on the competency gap. So I called, and I've been living in Nova Scotia, so that's another story why I decided to do Ontario instead of Nova Scotia. So I looked at the gap and I called Gala Luncheon's office, like, okay, I have this, I'm just wondering if there's anything I could do at the School of Nursing, how can I take courses? And the person from the registrar's office asked me, you said you have a good degree, like, are you planning to do your master's or, like, she just didn't understand. And the moment she said master's, it clicked. And she told me that I didn't have to be a licensed psychologist or nursing of a school to do a master's. And I was like, okay, that makes sense. So that was January 2014. She called Jackie. And, and Jackie was like, the admission closes in 2 days. And you're expected to submit everything, the documents from Nigeria, everything in 2 days. Like, that's not going to happen. And she was like, pay your application, put in everything, and then you can figure out the rest. So that was but by the time now I'm going off script, I'm not even reading.
And you have two masters now, correct?
Yeah. So that's like another pivotal moment. But one thing I did though, just trying to share the story. I went back to 2014, October. So I looked at all my emails from October 1st to October 31st and wanted to know where I was because I had already started the program at that time. And I'll just read out some of the things. So October 1st, I had some emails back and forth with Dr. Lisa Goodberg on assignment clarification for my nursing philosophy class. October 3rd, I was introduced by Dr. Sarita to Dr. Coaching, who was with ISIS at the time, and who has been working with a group of key partners in Nova Scotia on how to support internationally educated nurses. So this was for my course requirements that Sherry was teaching at the time. And that was, I would say that was a turning point. Like getting that introduction to with like making joy was a turning point that I could actually be an advocate for international educated nurses rather than just allow the system to treat us poorly and unfairly. So October 6th I was an MSN, and October 17th I had a conversation with a friend who was happy. So during my master's, I tried to get some hourly jobs, and I couldn't find any. So Dr. Wardrum was the only person who sponsored me, and I'm intentional about using sponsorship rather than mentorship. There's value in both, but for me, sponsorship went a long way. So I kind of had that first submission to her, and it was really good. That okay, I can do some research. In October 19, so that was like the first day, like in the master's program. So we were in a course and people were asked to have groups, and I couldn't find anybody who wanted to work with me. Really just kind of begging to please work with me. This was hard, right? I followed on. Then, October 27 was when I had my first presentation with Soul, and he gave me feedback. I had an A plus. I was so happy because that was my first grade in the master's program. I was like, yes, now I think I can do it, right? But after that, if you do a class, I'm like, yeah, I think I got a A plus because I can't remember, or maybe an A. So I did do well, but that first one, because this was someone, not that I didn't think I could do it, but knowing that the system has put a lot of barriers in place for many international educated nurses. So doing something and preventing on about migrant nurses, that was my topic then, and getting an A plus was like a more booster for me at that time. And then October 28th, I read this very coming. So for business course 2060, the nursing philosophy, or 5060, I can't remember. So I met with the guest speaker. And she talked about stories. So I went to email her because I needed more experiences. And she responded. So we kind of had back and forth. So you went back through. Just to buy it, I was sitting together today. And I think that's the first. I have another meeting with John just to know what I wanted to do. And that's what decided. And just fast forward a week later, I got a letter from Dr. Kathleen McMillan at that time that I was the recipient of the School of Nursing 65th Anniversary Scholarship. So this is really, really symbolic, right? Like just sitting here today, just thinking back to 10 years ago, have come and how far the School of Nursing had come because part of the pain then was that I didn't want to do a health policy practicum, so that's what I ended up doing. I didn't know anything about it, just wanted to do my master's and do my research because I did research in Nigeria. And when I met the person who interviewed me, and I was told, you cannot make it, like, you don't have what it takes to do it because when my education from Nigeria was converted to Canadian Nova Black House's GPA, it wasn't up to 3.7. But in Nigeria, I had an A plus. Right? So coming into health policy and not knowing what it was, I just wanted to get out of it. But as I went through the program, and there were moments that I just wanted, and I remember that first year of that first year going to meet professors, like, could you please support me? I want to switch. And this, like, I'm okay now, but I'm just reflecting, and I know when we talk about stories, if I sat here and just tell you it was all beautiful, I'll be lying, right? But when we've moved from that, and I remember one of two professors, one person told me I didn't have what it takes to do it, and the other person told me that I'd be close to them. I got a A minus in that person's course. So I was like, okay, that's all right. So that was something you can do it. So that was hard for someone who had an international experience and who had gone through a series of barriers. But I decided that that's something I could control, that that's their words, but that's not me. So I decided to just keep doing it. And I graduated 2016, so that was when I graduated. And it's just been wonderful ever since, and many people have contributed to that journey. So, yeah, I will pause there. Like, could we another time? I really get into it and just because I who helps you, yeah. Well, I'm happy in my vacation in Northern Ontario. I'm happy to have you here and also using that experience, listening to the native feedback, if you can call that feedback, and using this is as a moment now where normally you would list, you are critiquing the next generation and you are removing those barriers. Just like in our healthcare system, which is something we need. And again, to have the two of you on the stage here, and we do have nursing students in the audience this afternoon as well who are hearing these stories, and before you know it, 10 years, it's going to fly by. And you often hear politicians quite often saying nurses are key to our healthcare system. We hear this too from healthcare leaders. We hear this from patients. When someone says nurses are key to our healthcare system, what does that mean for you? Okay, who would like to start? Okay, all right. So it's common knowledge that nurses constitute the largest proportion of the healthcare workforce. And if someone knows, so it's just a no-brainer. Like, we are the key, like, for some. But it's not just to prove that we are the key. Like, personally, you have to, like, our perspective. So personally, I think an analogy I would like to use is that of a car. You could have, anybody could be a driver, and that's what we have in the healthcare system. So sometimes nurses are not in power and in positions where we make those policy decisions, right? So that's why I say like anybody could be a driver. But no matter how expensive or really good the car is, whether it's electric or gas, if all the other parts are not functioning, the car cannot go anywhere. Right? So that's how I see it. Think about the engine, think about the steering wheel. And these are the things we do in practice. Yes, we spend more time with patients. Yes, we advocate beyond the bedside. So it's not just like health caring 24/7, but we're always there to speak on behalf of our patients. And if you're working in the community, say I'm a population health nurse, when you're working with individuals who are experiencing, homelessness, who are on the margin, we are their voices, right? And we cannot do that if we are not a part of that talk, right, of our vehicle. So no matter what decisions are made on behalf of nurses, we are still responsible for moving that forward, right? So that's how we put it to work. We access, like, the healthcare system, and we saw that during the pandemic, right? When we had so many nurses were dying, so many people couldn't come to work, and all our hospitals, community, everywhere was just like, we're done, like, we need more nurses. And we talk about shortage all the time, and it's because we thought the healthcare system cannot function. Yeah. They are key. We are important that too, yes. So the data can be inexpensive. Sorry, going away. Yeah. Well said, yeah. What is key to you? What's that perspective when nurses are key? Thanks for the question. So to add to Glen's comment, I love the car analogy as well. I think there's a lot of invisible work of nurses. So not only in their care with patients and families and the expertise and the critical thinking that I spoke about earlier, nurses are everywhere. So, in a good way. I say that in a good way. And I don't think We may realize that, but although actually I think the public realizes that as much as we all do. So, these are educators, they're scientists, researchers, they are policymakers, leaders, decision makers, and carers. They are everywhere. 14,000, about that, in Nova Scotia right now, licensed. Only half a million nurses in Canada and millions around the world, and there is a nursing shortage. The nursing shortage was two books for decades. I wrote papers about it as a student. I mocked papers about it. During the course work around the pandemic for being exacerbated that. And this is a global change that we're facing. And nurses actually need to answer to a lot of the solutions for behavioral health transformation. Not alone. We do this, I think about colleagues where we do this collaboratively. We need to do this as teams. We need to take all the great work of nurses in all the roles I just mentioned to and do that with the teams and teachers and scientists, but also can help those who are being directly and those who are the users making it all happen. Collaborative care, which we're seeing more and more. You mentioned the global impact of nurses. Are there any global or societal trends that you are seeing right now that you think will really be a part of nursing 5 years down the road? And whatever trend that is, how can nurses respond to it? Hopefully not another pandemic. Not enough of that. Yeah. It's a bit of building the Tamworth Study Program, the workforce challenges, because challenge is opportunity. And a colleague of mine, a professional, comes to work for life. And so to everyone who maybe isn't currently practicing as a nurse, don't practically as a practice and reading all the beautiful ways nurses practice. And for the students who are here who are learning and then will be practicing as nurses, being a nurse for life is a fabulous thing. Because the work that you do, you are seeing the possibility in your work. So we often think of everybody working in healthcare, and nurses, a lot of them. So at Nova Scotia, there are 10,000 nurses almost. And they are doing all of that work. They see the problems, but they also see the solutions. Right? And so they are the innovators. They're the ones bringing the ideas forward. So if you think about workforce, internationally, other nurses coming and joining us, which diversifies the workforce, brings new and fresh and wonderful perspectives to our communities and excellence from other health systems. New nurses, so new graduates from nursing programs, and Ruth and others, and Brenda, we've done lots of work on increasing nursing seats and programs because we need more nurses in the system. If you think about how we want to retain nurses, we need to take care of each other in healthcare, so we think about wellness. People need to be passionate about people need to know that they need to be and all the nursing students in the back, check your hands again. You have a career in nursing. The possibilities are endless. And I'll use myself as an example. I've been a care home, an educator, a policymaker, a formal leader, always a leader. You're always a leader in everything that you do. Worked in many areas here in Nova Scotia, the Atlantic, and the North. There is so much we can do. Find your passion and do it. And then if we think about redesign, and Ruth mentioned, and I think we'll do a little bit too, some of the cool things happening, our prescribers, the nurse practitioner scope of care, how people are working together collaboratively. That is transforming healthcare, and nurses are central to that. Yeah, that's so good. And just kind of beating what you said, and you wanted us to talk about one, like what's my one? There's more, yeah. Because you're thinking about what can we kind of do together, and what are the implications for communication and all of that. And I think of the aging workforce, the aging population of the workforce. last just like 2 days ago, so Thursday we had a tutorial in one of my courses, 27th on population of nursing. And in that tutorial, the students were asked to, I don't know if anybody's familiar with the Global Burden of Disease tool. So they just go on their website, just pick whatever country they want, just pick any graph, any data, and talk about it. And a majority of the group talked about fertility decline in many countries. And they also talked about the pyramid where now we have more aging population. And by 2100, the year 2100, some countries are going to like twist it up. Why? Because they are 0 to 5, then the youth population and the work, the labor workforce would have really reduced, and then the age, even the aged or the elderly population would have really increased, and that got me thinking, right? That's where we're gonna be in the next 5 years, and we're already there in Canada, in Nova Scotia. But it's good news for the nursing workforce because I remember 8 years ago, we were talking about the aging workforce. But now we have younger workforce. But when you think about a younger workforce, think about their lives, maybe they have families. These are people who do not want to work full time, right? Because they have other things, they take kids to sport, all of that. But we have a population that is likely, and already they're saying that they have more healthcare needs. Think about chronic diseases. Think about even supporting, like psychologically, in nursing homes, and think about how diseases like dementia is looking differently now. So, like now we have many Black Canadians who are coming up with dementia, and many years ago it wasn't like that. So that alone, I think, has implications for what we do as nurses in education and policy and practice to make sure we have enough workforce, like in Nova Scotia and other parts of the country with reason immigration. And the question is, are we doing it fairly and equitably that when international educated nurses come to Canada, come to Nova Scotia, they are able to practice? I always say something like, and I said this yesterday at a meeting that we attended, that every country educates its nurses for the context of that country. So if you brought Canadians, you took them to Nigeria, they're going to think it's going to be hard for them to practice because they have no idea how the processes are, how the system is structured. So let's flip it. Bring a Nigerian nurse to, or a Filipino nurse to Nova Scotia. They're going to struggle, right? But what are we doing to support them? That's why. And thinking about education, where we know that we have an aging population, are we preparing nursing students for the complexities of the workplace? When it comes to provide care. And what I've seen, like in nursing education, is that we are still focused on hospital care, on acute care, right? So we know that many people want to work in the hospital, and the education we provide is kind of tailored to that. When they write their own class exam, it's really like acute. And now, with the aging population, we have many more people in the community, in home care. It's when we don't have students, graduates who want to be there. So we kind of provide care, right? Think about technology. AI, we did so well during the pandemic, and it's just so unfortunate that now we are going back to pre-pandemic. And there are some studies about it that we utilize technology, but now it seems like we are at our comfort zone, like, yeah, we should go back to where we were. We shouldn't, right? So just something.
Well, with you two teaching the next generation of nursing students and just hearing your thoughts, I know we're in good hands. You have been a very attentive audience. We do have one more question for you two. What are the key messages that you want to take about the nursing profession that you want to share with everyone who's attending here today? So these are people who are still working in the nursing profession, teaching, and of course the next generation of nurses who are going to be working in the healthcare field. What is the key message you would like them to take away from today? So I think three key things. Find your passion. Find the work that, and the practice, and the role, and it can change a bit over time, that fills your heart, fills your mind, makes you feel connected. I can tell you as a new grad, I was driving in to the UK, to work in it, and I'm excited. Another person identity, but family is my identity. So I'm the place for you to make this real value system that gives you growth, that gives you that power and that energy. Never stop learning. I learn something every day. I learn things today. And keep your critical thinking hat on, gather information, understand stories, keep learning all the time. Push yourself, find some positive challenge in your life and your purpose. So you're always being inspired to do that. Find your mentors. I always have mentors. Always. I have all of them for several reasons. Find the people you can trust, you feel psychologically safe with, you feel safe to ask that key, should I do that question? What do you think, Kirsten? And be your mentor. Always reach out, always be available to new people who are trying to build their careers and move along and find the right path. And just taking moments with people to connect and make things happen. It's great mental practice too. Very over to you. Yes, yes. So firstly, I really wanted to appreciate the committee for inviting me to this year. It's honoring and I don't take it for granted. And just thinking about what I would tell, I would say maybe like students and then us who are not students. So really talking about the present and the future. First, I think I'll start with the leaders. We need to reimagine nursing leadership, right? We are we're not there yet. But I would say that we're in the place, right? And one of the things we need to do differently, and this applies to nursing students, is that we cannot just do nursing and we want to change the world. We have to always think outside the box. So if you're a student nurse, I get it, it's hard getting all the assignments and all of that, but always think about the add-ons that you have to add to your education because it's going to set you apart. I personally, and I'm opportune to kind of pivot at a time in my career where I decided to go do another master's. I'm like, I love public health. So I was just like ambitious to study master's in public health, and now I'm doing a PhD in public health. And I would say it has opened a whole new lot of opportunities that I never thought about. And the question is how many different spaces think. But if I was just in that mind of nursing and nursing, I think I would do myself a disservice. And I'm saying that with all humility. Not that there's a deficiency in nursing, but we have to be ready for the life out there, which is not only for nurses. And in order to do that, we have to think about the skills that we need, the soft skills for students. Like the passion is great, like mentorship. I have a lot of mentors, and that's why I'm here today. And I have so many sponsors, and I'm talking to leaders. Like when you have students who maybe they're struggling or maybe don't even know where to place them, sponsor them. And what sponsorship means is that you are taking a chance of that person and giving them the opportunity to excel, right? So we have to do that collectively. We have to view the future collectively. So beyond just, us looking for opportunities and enjoying being a nurse, like you have to think like what else outside of nursing can add to this beautiful profession
I never wanted to be a nurse, and I wouldn't change it for a thing, because I've had that opportunity to see so many other things outside of nursing. So I think that's what I would add to Annette's comment.
Okay. Nursing, always and thank you for your help. Danny and Annette, thank you too so much for taking the time, for going through the nursing profession, continuing to teach the next generation, and for sharing your advice here today. I think we all appreciate it. And thank you all too for being such an attentive audience and for coming out today. And congratulations, 75 years of nursing here at Dalhousie. And if this is just a taste of what's to come, another 75 years is going to be a very exciting time at this university. Thank you so much, and congratulations on all your accomplishments and all that you continue to do. And thank you so much for letting me be a small part of this incredible milestone.
Thank you very much. Thank you very much.